Hello everyone, welcome to Health is Wealth on Hill Media Africa, where we talk about various ways to sustain a healthy living. And today we are looking at the health workers in Nigeria, and we are narrowing it down to the nurses as they celebrate their Nurses Week. As you all know, nurses are wonderful. They go about doing a great job in our society. So let's find out how the nurses are faring in their profession.
Nursing is a very noble profession. We care and God heals.
Health is wealth.
Like she said, we are going to municipal right now for the free medical treatment. Tomorrow we go for the church service. By next week, Tuesday, we now start our scientific section. We need more manpower in the health sector. Seriously, we need them because most nurses are retiring, most nurses are going away, traveling, and we need more nurses to be empowered, more nurses to be employed so that the manpower will be enough to satisfy the Imo State health workers.
We want the total support from the government to appreciate the work of nurses in Imo State. In Imo State Specialist Hospital, frankly speaking, we are only 44 nurses being employed by the government. So we can't cope with the 44 numbers we are. Then the hospital have to engage contract staff nurses. And it's unbelievable that these contract nurses are being underpaid. They are paid 50,000, some 62,000, and they are compelled to work from 8 to 6 p.m.
Surely there is exodus of nurses. There is a big brain drain in healthcare service delivery in Nigeria as well as the states. And one of the causes is remuneration. Many nurses are being underpaid. The skilled nurses, what they are being paid here is nothing to be compared to what they are being paid internationally. And if you want nursing profession to stand the test of time, definitely the government should look into those areas in the sense that there should be upgradement in the scheme of service. There should be good welfare package for nurses, because once somebody, you find out that during the COVID-19 era, many of the nurses died. This is as a result of poor working environment.
Since the inspection of the governor, he has been trying. We still have some pressing needs that are peculiar to the hospital. Since 2004 that the hospital started working, we don't have any pension scheme, and this is making our morale there to be reduced, and then many are leaving the hospital because of that. And also, it's a teaching hospital where we train nurses and doctors, and we lost our accreditation, making the student nurses and doctors to move down to FMC for their clinical postings, which is not good and favorable for them with the security that is, with the type of security that we have in the state. So we are pleading with the government to help us and restore back our accreditation so that our students will continue being trained there, and then also help the consultants that are no longer working with us, bring them back by giving them their remuneration and paying them their salary so that they can be able to teach those young doctors and nurses.
You can see that we are doing our medical outreach. The nurses are checking people's blood pressure, blood glucose level as one of the activities embedded in our Nurses Week.
We also have family planning communities here. The men here, you are free to collect male condom, it's free. Female condom is free. We ask people, women, don't deny your husband sex. It's not good. And we ask men, don't go outside, because you might eat a goosey soup or banana soup, you start thinking about the one in the house. So the male condom is here for you to use. The woman, the female condom is here for you to use.
Nurses are caring and epitome of humility and service. We especially go there for this occasion. Yes, I'm proud to be a nurse.
Health is wealth. You have heard it from the nurses. Nurses are essential part of the medical system. You cannot talk about the medical care of any country without mentioning the nurses. Instead of losing our best brains to other countries in search of greener pastures, it is better the government improve the working condition of the health caregivers so that they can give us their best services. So here comes the end of today's episode of Health is Wealth on Hill Media Africa. Join me next time, same station, as I bring you another wonderful topic. And remember, subscribe to our YouTube channel, like and share this video. I am Miss Goodness Suto. Please keep watching and bye for now.